Hi everyone, welcome back. So this is the first one of probably about 4 videos that I'm going to do, which I'm going to sort of call Gains Without Pains. Basically, I'm going to be talking about common exercises that we do in the gym, and really just how to reduce the risk of injury by overcoming those common mistakes that we make, and by showing you how to do these exercises using good technique that won't put extra stress on the muscles. Now, I want to emphasize the point now, I am not a personal trainer. So the information that I am going to give you in these videos is based on my anatomy and physiology knowledge and my experience with my sports therapy clients, and just sort of my knowledge of how the muscles work in these exercises and which muscles take the impact, etc. And how we can use that knowledge to, ensure that we're using proper technique. My job as a sports therapist is not just about treating injuries and, giving a massage. It's also about teaching, how to prevent these, sometimes performance limiting injuries through correct technique and posture, so that then the client can go away, they can continue to reach their goals and become fitter and stronger, without placing, extra stress on their joints or on certain muscles. So as I say, this series of posts, it will really just take common exercises done in the gym. It will look at correct posture, correct technique in order to reduce the risk of injury. So in this first video, I am gonna talk about a few exercises. Some of the videos will be a little more detailed because there's more involved in the technique. So for this video, I am going to be talking about kettlebell swings. I'll be talking about lat pull downs, stomach crunches, and also lunges. So for this the first one we're going to talk about is kettlebell swings. Now, the benefits of this exercise. So they're great for increasing strength and also burning fat at the same time. Now, a common mistake that people make with this exercise is that they, get really enthusiastic and they start too heavy. But, if you can master the technique first, before going too heavy, that way you're going to help reduce, the risk of injury. And there are various signs that maybe, you've gone too heavy to start with, or maybe you're not using the best technique. So, if you're carrying out the exercises with a rounded back, if your knees are buckling inwards, if you are raising the shoulders, using the shoulders and the arms for the movement rather than using the hips and the glutes to swing, will actually really make the exercise quite ineffective and increase the chance of injury. If you're lifting with the back, and then you're probably going to find that you get soreness with the back after doing it. And also if you develop tendinitis as well, that can also be a sign of poor technique when doing these kettlebell swings. So what is good technique? Well, you want to ensure that you keep the back flat, and that you maintain good posture throughout, that you're not rounding the back. and that you're not sort of raising those shoulders up. And you want to, as you do the upward swing, you want to make sure that you're squeezing the glutes and pushing those hips forward, and that is where that sort of swing and lifting movement is coming from, rather than lifting with the back, which is just going to put strain on the back. Also doing slow, controlled repetitions is going to be a lot more effective and reduce the risk of injury than if you just kind of do it as fast as you can, which usually if people, are using that sort of just get it done and out of the way, it's usually because they're actually kind of starting off on a weight that is too heavy for them. So, now, there has also been sort of heard as well that, we talked about one of the signs of poor technique being tendinitis. And certainly I have read some things that suggest if you let the kettlebell just kind of drop, that is actually also poor technique, whereas if the sort of line of the kettlebell follows the line of your arm as you're swinging upwards, that is the technique you should be using, and certainly that would make sense in regards to how much stress is put through the wrists, which could consequently cause tendinitis there. So, so the technique for kettlebells is actually, there's not too much, to it, just as long as you focus on those correct muscles. And I, as I say, I'm not a personal trainer, but I'd say if you're starting off doing this exercise or any of the others that I'm going to talk about, then, definitely, or if you're coming back following an injury, and starting up again, make sure that you talk, to one of the personal trainers and just get their advice as well, because obviously they do this every day, and they may also be able to sort of suggest some other things to minimize injury. So that is it for the kettlebells. Okay, so the next exercise that I'm going to talk about today is stomach crunches. Now, stomach crunches are, fantastic for strengthening the core muscles, particularly on the abdominal muscles, and also improving, your posture in general. If you have watched my videos on the pelvic floor or abdominal diastasis, certainly one thing to say is that, these exercises shouldn't be done if you have pelvic floor weakness or separation of the abdominal muscles, most often seen sort of following pregnancy, because the sustained abdominal contraction actually puts further pressure onto the pelvic floor, and can make abdominal separation worse. So just do be aware of that. So with regards to abdominal crunches, what are the common mistakes that people make? Well, certainly, if you come up too high from the floor, because when you crunch high, what actually happens is you're transferring, the focus from those rectus abdominis muscles onto the hip flexors. And so then you're actually a lot more likely to strain those hip flexors and cause a weakness there. Again, we said it with the kettlebells. If you rush the repetitions, then what happens is you're using momentum rather than strength. to work those muscles. And so you're not going to get the same benefits as if you just slowed it down and really focused on each movement. And it can also, again, put extra stress on the joints and increase the risk of back injury. So just by slowing down, using good technique, you can really, prevent a strain to those back muscles. Tucking the chin into the chest, that can also put a little extra strain, on the back. So, just maintaining a neutral position, is better. If you sort of yank your neck, sort of on that upward movement, you actually increase your risk of having a neck strain. And, you then also end up using your arms actually to do more of the movement, which actually then just renders the exercise ineffective again, because you're not using those core abdominal muscles. Another mistake people make is that, they'll work really hard on that upward move, but then they just relax on the way down, which again reduces the ineffectiveness. Just as if you were, lifting a weight in the gym, you don't sort of work really hard to push it up and then just flop it down. You kind of slowly bring it down so that you're still working the muscle. And it's the same kind of concept with an abdominal crunch. If you, slowly lower yourself back down, that's still going to be working those abdominal muscles, which is the whole point of the exercise. So, breathing. Breathing, we know, is always important with any exercise, to ensure that you're getting enough oxygen intake. But, a lot of people, when they do abdominal crunches, will actually hold their breath. And all this does really is just deprives the body of oxygen, and hence, negatively affects your ability to do the crunches. So those are the common mistakes. So how do we do this exercise, more effectively using good technique? So when you do a stomach crunch, you should really only raise the shoulders about 3 inches off the floor, which doesn't sound a lot, but actually it's plenty to be able to work those abdominal muscles. Again, we talked about tucking the chin in. Maintain some space between the neck and the chest, and that will help avoid back strains, and also sort of neck strains as well. Avoid using a sort of a jerking movement, up into the crunch. Just a slow, controlled movement is much more effective, and again, just reduces the chance of, straining a muscle. So performing the exercise slowly, really focus on engaging your core rather than using your arms or your neck and shoulders to kind of push yourself up. By engaging those core muscles, that will really ensure that you are, getting the benefits that are intended from this exercise. So that's really a good technique for stomach crunches. Okay, so the next exercise that I'm going to talk about is the lat pull down. Now, the benefits of this exercise, obviously it works the arms, but obviously the main focus are those lat muscles down the side of the back, running from the shoulder. There's a couple of common mistakes that people make with this exercise. One is that they may pull, to vary the exercise a little bit, they may pull the bar down behind the head. But what this actually does is it means that you end up pushing the head forward, which can strain the neck and into the shoulders there, and therefore increase the risk of injury. If you don't activate those core muscles around the stomach and the back, actually what that does is it results in you bending the back, which then can cause also excessive internal rotation of the shoulder and overactivation of those trapezius muscles at the top of the back there, which basically is just, going to mean that the exercise is providing minimal benefit to those lat muscles down the side there. And that's the whole point of doing the exercise. And also it means that if you're bending the back and overly rotating the shoulder, you're going to increase the stress on the spine, on the neck and the shoulder joints, therefore increasing, the risk of pain and injury. So how do we improve our technique and ensure that we're not doing anything that puts our bodies at risk? So firstly, bring the bar down in front of your body. Pull the bar down towards the chest level, and keep those shoulders back and down. We don't want any internal rotation. Lean slightly back from the hips, not arching the back. As soon as you arch the back, you're going to put strain on that area. So lean back from the hips, keep the shoulders back and down, pulling the bar down towards the chest, but bracing those core muscles, the abdominal muscles and the spinal muscles, just keeping those, engaged, and that will help reduce the pressure, reduce the impact on those shoulders, and it means that you'll be engaging those latissimus dorsi muscles, which is what this exercise is intended for. So, all pretty straightforward, but surprising how many people don't actually do it. So that's it for the lat pull downs. Okay, and so the next exercise that I'm going to talk about in this video is the good old lunges. Okay, so lunges, the benefits of lunges. Obviously, there are different variations of a lunge that you can do. So we're going to talk generally here. Lunges are great for improving balance, because it means when you're doing a lunge, it means that you're training each side of the body independently, rather than, working the body as a whole. You are certainly going to strengthen not only the core muscles, but also obviously working the legs and the glutes in these exercises. So what are the common mistakes that people make when doing lunges? So certainly just poor posture in general. As with all exercises, this is certainly going to probably increase the risk of injury and reduce the effectiveness of the exercise. Certainly the positioning of various parts of the leg is significant with doing lunges. Don't let, a lot of people will let the front knee lean over the toes, but actually what this does is it strains the knee. People will have maybe the feet on the same line, but that's just going to reduce the stability when doing the exercise, which again means that you could potentially end up putting a lot of strain or sudden impact on a muscle that actually isn't the focus of the exercise. Sometimes, the front knee may collapse inwards or, be a little bit shaky. The front foot could be unstable on the ground. You may be leaning forwards or backwards. The lunge may be too short or too long, and these things can result in you sort of having jerky movements within the exercise, particularly, when you're stepping back. Also, if spoken a little bit about the front leg there, but if the back knee is too low, the leg won't have the necessary strength to, execute the movement properly. Maybe body weight is, wrongly distributed, or, if the front heel is coming off the ground, that's going to provide instability in the movement. If you step with the heel first, again, that's putting a lot of pressure, through that sort of lower calf. And probably, the other mistake is when people, if sometimes they kind of aggressively push against the ground, again, particularly on that stepping back movement. So, all of these mistakes that people make can have a lot of consequences. They can cause pain and injury to the knee, the ankle, the foot, and also the calf muscles as well. They can also cause back pain and shoulder pain, and promote poor posture. If you're not distributing your weight evenly, you sort of push the sort of impact of the movement through the wrong muscles, and that's why it can affect the back and shoulders. And basically any of those sort of poor techniques, those mistakes that we've just mentioned, mean that you're not training the right muscles. And as I say, you're going to end up straining others, because the sort of impact is going to be misplaced during the exercise. So how do we ensure good technique when doing lunges? This is pretty simple, just maintaining a good upright posture, not leaning forwards or back, and ensuring that both knees are bent at about 90 degrees during the forward step, and just ensuring that knee doesn't push, past the foot, and, that you, your foot position is stable. So it sounds easy, but a lot of people don't do it. So that is that's all actually for this video. I'm going to be doing probably about 3 more videos on this Gains Without Pains series. So I'm going to do another one where I will talk about squats and also leg press. And then I'm also going to do one talking about the Romanian deadlift and one talking about the clean and jerk, which obviously has quite a few sort of stages to that exercise. So by all means subscribe to my channel and you'll be notified when they come out. Likewise, you can comment down below or contact me through my Facebook or Instagram. But as I say, if you're starting out doing these exercises or you're coming back after injury, ask a personal trainer at your gym, because they obviously deal with this in terms of the exercise itself on a daily basis. And, you know, the points I've raised here are, as I say, based on my knowledge of anatomy and physiology, you know, and sports injuries with my clients, rather than a sort of a daily, you know, sort of working daily in a gym setting. So yeah, so that's all for me for today. So I will see you for the next video. Okay, take care. Bye.